Kevin is 27 years old, healthy, active, no obvious problems. But for the past 2 years, something has been quietly wrong. In restaurants, he nods along to conversations he can't fully follow. He asks colleagues to repeat themselves constantly. He turns his phone volume all the way up. And in noisy places, he literally cannot understand what people are saying. So he finally goes to the doctor, sits in the soundproof booth, raises his hand every time he hears a beep. The results? Perfect. Normal hearing. But there is something wrong. Kevin just has something that standard hearing tests cannot detect. It's called hidden hearing loss, and research from 2025 suggests it may be silently affecting over 1 billion people right now. And before the habits, because this is important, this video is not about hidden signs of regular hearing loss. Hidden hearing loss is a specific medical condition. It involves damage to the tiny synapses connecting your inner ear's hair cells to your auditory nerve, damage that doesn't show up on a standard hearing test. Your results look completely normal, but the quality of how your brain receives sound is permanently compromised. Scientists call it cochlear synaptopathy. You can hear, you just can't understand, especially in noise, and no standard test will catch it. So what are the everyday habits that are actually signs of this? You rely on lip reading without realizing it. You think you're just paying attention, but you're compensating. The moment someone turns away mid-sentence, you're lost. That's your brain filling in gaps your ears can't. You feel exhausted after social events. Not introversion, not anxiety. Hidden hearing loss forces increased listening effort, leaving you mentally drained after conversations, because your brain is working 2 to 3 times harder than it should just to decode speech. You always have subtitles on, even in your own language. If dialogue genuinely sounds mumbled or unclear without them, especially when there's background music, that's your auditory nerve struggling with complex sound. You avoid loud social situations. You tell yourself you're tired or it's too loud. But the real reason? Following group conversations with multiple speakers feels overwhelming when hidden hearing loss is present. Avoidance becomes the coping mechanism, and social withdrawal quietly follows. You only struggle in noise. This is the biggest tell. One-on-one in a quiet room? Fine. The moment there's background noise, a TV, traffic, other voices, everything collapses. A significant portion of patients with completely normal audiograms consistently struggle to follow conversations in noisy environments. That selective breakdown is the fingerprint of hidden hearing loss. 60% of young people now use headphones for several hours every single day, and the damage doesn't feel dramatic. Silent part? Hidden hearing loss may be permanent and progressive. The synapses don't grow back. Kevin isn't imagining it, and neither are you. Hidden hearing loss is real. It's rising, and it looks completely normal from the outside, which is exactly why most people never connect the dots. If this made you think differently, share it with someone who always has the subtitles on.